Welcome to the Beverly Hills Plastic Surgery Podcast. Dr. J. Calvert today. We are fresh off a mid-facelift with my amazing co-host, Dr. Millicent Rovelo. How are you?
I'm doing great. You are correct. We did a mid-facelift together. It was amazing. She looks so good. She's going to be thrilled. But we're not talking about that yet, but stay tuned.
We might.
That's going to be our next one, but we might. You're correct. Oh yeah. Ooh, little teaser for what we're going to talk about. Because what we're actually going to talk about today is what everyone's been talking about in the media, and if you're following along on social media, it's what's known as MAGA Makeover, or Mar-A-Lago Face.
The MAGA Makeover.
MAGA Makeover. So I want to just get into...
It sounds like it should be good, but however...
Well, it depends who it is.
We have to talk about this a little bit.
Yeah, so let's break it down and let's talk about whether it's good or bad or otherwise. But what is it? That's the question to start off with.
First of all, it's a media term because
there's
there's no plastic surgeon advertising the MAGA Makeover.
We did not learn about that in residency. No, that's not.
I never went, you know what would be good marketing right now? No, that's not really from the plastic surgery community. It's from the media.
Yeah, but as soon as you say it, everybody literally knows what you mean.
They do. There's a look to this new administration. Well, I guess it's not that new anymore. It's been more than a year, coming up on a year, I guess. And it is this extreme kind of filled, shiny, polished face that is a little bit unnatural.
It's a little strange. It's like you took the idea of what a feminine face should look like, and then you turned it into an extreme version of itself. So you took what you think is supposed to be all the beautiful things about a feminine face, and then you turned it up to extreme levels.
This is what happens when I don't know if it's the patients that drive it or if it's the aesthetic, and I'll say aesthetic doctors because it doesn't necessarily have to be plastic surgeons. Right. It can be dermatologists. It can be aesthetic practitioners such as PAs or nurses that do injectables and lasers. It's when there's this drive towards some ideal that is – it's like when CO2 laser came off of TikTok and every patient came and said, and I definitely want a CO2 laser. I was like, clear you don't know enough about that because there's some risk to that. Let's go over it. You can get one, but let's see. And we see these people that are just getting –
let's talk about the look. Let's talk about the look and then talk about how they get there.
Yeah.
Right? So this is the look. The look is usually a very overfilled face. And so that means that the cheeks are very full. The lips are very full. The whole face in general is very full. And then that's usually combined with some kind of extreme makeup on the face. So the pancake foundation that's an inch thick and the big eyelashes and the dark eyeliner that make their eyes look so squinty. So it's this extra big fat face combined with very heavy layers of makeup and then usually some big hair, which I can't say anything about because I also like big hair.
I mean, and by the way, if you do that stuff right, it looks good.
It looks good. All of these things are, and well, here's the caveat, because the assumption is that the people that are having this look also think they look good. So again, it's a little bit of a beauty in the eye of the beholder because they're going in and requesting this stuff because they think it's going to make them look good or they think it looks good. So we can sit here and say that maybe we don't think it looks good, but maybe to them they do. So I kind of just want to talk about how you get to that look, should you be so inclined, and what would be the drawbacks of that?
I think that it is probably regional. It probably is being driven, in the politicos of D.C. and New York. With
a trickle-down effect to other people in the country that aspire to have the same look.
Yeah, I don't know that you'd aspire to have this look. It's a little
aspire. I know that it seems. I'm telling you,
it's not me.
People are looking for the look.
My people don't want that look. My patients are looking for natural and beautiful, and again, I always come back to the classic beauty, the handsome look, just the Robert Redford good looks for men, the Audrey Hepburn looks for women. There's the Iman looks for, the African American woman. There's certain looks that are just, they're so classic beauty.
Beauty.
And this isn't that.
So how they're getting this, and we can differentiate that between how maybe we would address the same thing, is that a lot of times these are women who are getting, probably into their 30s, 40s, 50s. So they are seeing signs of aging, and they are opting to go the filler fat grafting route to address the changes that they're seeing, but to like an extreme degree. So what happens with aging, the soft tissue of the cheeks fall down. You start seeing some hollowing under your eyes. You start seeing that lack of fullness in your cheeks. The lips get a little bit smaller. You start seeing jowling around the mouth and the jawline. And there are the ways that you can treat this.
You keep looking at me when you say those things.
I do not. I'm not looking at you. I mean, I kind of have to look at you.
Yeah, it's right there.
But one way of treating these things is to put filler in. But filler can only take you so far when you're trying to address some of these signs of aging. And if you keep putting more in to keep fixing these problems, you end up looking very strange. You get the very pumped up looking cheeks, and then the face looks overall fatter, and the lips start looking really strange. So the look that they're going for, or that they end up getting, is usually due to a lot of volume being placed into the face, and then combined with the superficial makeup and stuff like that, which is different than I think what you're trying to get at here. And the look that I think is probably a little more common on the West Coast and Los Angeles. There are certain pockets and certain people that are going to have that kind of look as well. But I think here we just want to look great, but like, I'm not going to say the word natural. Our nurse corrected me today when I said natural.
he said, oh, honey, don't use language like that around me.
Ew.
Natural.
Natural.
Oh.
Ew. No, but you want to maintain the architecture of your face. You want to see what we call natural, sorry, Matthew, the natural bone structure of your face, the beautiful cheekbones coming out in a place they're supposed to be with the appropriate amount of definition. And you don't have to put a ton of filler in to achieve that look.
No, the filled look, I remember, I think I've talked about this before on this podcast, where I was getting ready to go to a meeting and my buddy got there early and he sent me a picture of him with one of the organizers of the meeting. And his head was so big, it was twice the size of the other organizer of the meeting. And I like called him immediately. I was like, dude, you gotta lay off the fillers. I like sent him like all these like protractor I was like, your head is twice the size of so and so's head. Like you are and his face just blew up
so big,
and it obliterated his structures.
Right.
So like you couldn't see cheekbones, you couldn't see the brow contour. Like he just looked like somebody put the bicycle pump on him and just
blew it up.
and just blew him up.
And the thing is, like, it can be addictive in a certain sense. Like, you kind of start losing perspective of what your face looks like or should look like. And if you have the money and you have the means, as soon as you start seeing your face deflate a little bit, you're back to your doctor asking for more injections. And it can build on itself until you get this really fat face. And because you kind of just lost all perspective. And if there's nobody telling you, honey, like, put down the needle, it can just really build.
Yeah, and it looks bizarre.
And it looks bizarre. And I think what I would prefer, what my preference, and I'm sure your preference is too, granted we're plastic surgeons, but fix the problem. If you're seeing signs of aging, don't be afraid of the facelift. Don't be afraid of the mid-face. Don't be afraid of the blepharoplasty. Fix the problem. Get your anatomy back to normal, and you're going to look fantastic. You don't have to do all this volume in the face, which just doesn't make you look younger, by the way. It makes you look actually older and trying too hard. It makes you look like a try-hard, as my son says.
Yeah, one of my patients got a facelift like somewhere else. Like I fixed a bunch of stuff for her, and I just saw her recently, and I can't believe she went somewhere else, but her facelift aged her easily 15 years. And Isaac Mizrahi, I'll never forget it, back when I was in my residency, he said nothing will age a woman like a bad facelift. Nothing will make you look older than when you get those vectors wrong. And he was so right, because that is what makes people look strange. However, I do want to preface our comments that I think these people like it.
Yeah, that's the thing.
I think they like it.
That's the look they're going for.
So just because you and I like classic, handsome, and beautiful, this new mantis look seems to be in. So I don't want to tell everybody like, hey, maybe you don't want that, because maybe there are people listening to us going like, those two old geezers think that Robert Redford was a good-looking guy. They think Paul Newman was handsome. Like, what's wrong with them? You know, they think Brad Pitt's a good-looking man. Like, they may look at that and just be like, what's wrong with them? We want somebody who looks like the Predator, or the Alien, or we want somebody that looks like a mantis. Like, we're looking for that out of this world bizarro look, and it seems like they must like it because they walk around this way.
So then this is also the podcast for you. If that's what you want, then here's how you get it.
It's so easy to get.
You go to your doctor and you say, put 10 syringes of filler in me.
There you go.
Or you go to your surgeon and you say, I want to have 50 cc's of fat put in my face.
Yep.
And then you're going to go back in 3 months and say, I want more. And then in 3 months, I want more. And so it's not hard to get. You just have to have the money and the means and a doctor willing to do it. Because all it is just a ton of volume being pumped into your face. That's all it is.
Yeah, but in a way that really changes the architecture of your face, and to me, to my opinion, takes away from the beauty and the attractiveness.
Right.
Like, I would wonder, like, too, like, I'd like to, get a, this might be a good thing for like a crowdsource kind of move to say, like, here's, this person before they had anything done, here's them with the MAGA makeover, which is better?
Right. And to be fair, a lot of times those photos that they're showing on social media are of these people who were like 20 years before. And so that's not really a fair comparison where they're going to look great because they're 20 years old.
But maybe we can find some actual plastic surgeon before and afters, because typically the plastic surgeons who do these things will show them off. And I will reference an episode of the Dr. Phil show that I went on. Drew calls me one morning. He's like, hey, Phil needs somebody to come down to the studio. He's like, I'm not there. Can you go down? They're talking about extreme plastic surgery. There's this guy who's having his 50th operation, and he wants to have a party and celebrate it. And I was like, no, I got to go do this one. So I go down, and there's, Dr. Shuge and his patient. And, he and I are the in-office experts, and then the patient's on the stage with Dr. Phil. And Shuge's a really nice guy. He's a good plastic surgeon at the time. He's probably retired by now. And the patient goes up there and, looks extreme, like just cheek implants and chin implant, and looks just, so like, just like a plastic doll almost, and loves his look, very into it. He's a hairdresser, and he's like in Beverly Hills. He's like, this is my look. It's kind of what I've grown to be. I'm excited for my 50th operation. I don't even know what it's going to be. And I'm looking at Shuge, and I'm looking at him, and I'm looking at Shuge, and I'm looking at him, and they look alike. They really do. Like, his look is like his doctor, and Shuge obviously is a toned-down version of it, but he had the same thing. Probably had some cheek. I don't know what he had, but they looked alike.
Right.
And, I said, look, this is what he liked, because then Phil, turns to me, Phil McGraw, and he turns to me, he's like, and he kind of knows what's coming. He's like, okay. So, they talk back and forth about the party they're having for the 50th operation. And he says, Dr. Jake Howard's in our audience, and he's known for his natural results. And so I just kind of said, I don't even know what to say. It's like, they're both happy. Like, I got a happy surgeon sitting next to me. I've got a happy patient on the stage. Who are we to judge? Like, we don't like it. So who cares?
Yeah.
Like, they don't care that we don't like it or do like it or whatever. I don't really have a dog in this race because I don't do this. But I kind of just said, my take-home message was, if it's safe and you like it and you want to go that direction, more power to you. If it's empowering and makes you feel better, then do it. And this, this MAGA makeover thing that, is, obviously the media is kind of creating it out of the new administration's people and the Fox people around them. And if they like it, okay. Like, maybe we're all looking at it going like,
yeah, no, 100%.
I don't know.
The whole point of this is just to say, like, how did they achieve that? Because everyone wants to know, like, what is this look? And the point is, well, this is how they got it. They just put a ton of volume in. Maybe some of them have had plastic surgery, but my general look at them is that they needed plastic surgery and they didn't get it.
Yes,
and they just filled it up.
Fix the problem.
They needed the facelift, they needed the blepharoplasty, and instead they just threw volume at the problem. And that to me is not great, but if that's the look they're going for, fine, happy to do it. But I think it must be said, yes, surgery certainly has its complications, which we talk about all the time, but so do fillers. Fillers, I'm more scared of fillers than I am of doing plastic surgery.
Definitely.
100%. And fillers can have complications related to blood flow. So you can occlude a blood vessel and the tip of your nose could die, or you could go blind, or you could lose part of your lip. The fillers themselves can create allergic reactions and infections. And by the way, they do not go away in 6 to 9 months like the companies claim that they do. The companies say that so you'll be back in the office every 6 to 9 months getting new filler because you've been told it's gone away. But we've gone back in faces 10, 15 years later doing a facelift, and they still have filler there. I've seen CT scans and MRIs of faces that have filler that has migrated from its original position, that it was placed 5 years ago, 10 years ago. So filler is not a benign, simple thing. It's not like going and getting your teeth cleaned. It really does have some potential side effects. And if you really are plumping your face up to this degree, what's going to happen when all that filler comes out or gets dissolved? There used to be this thing that was like, I can't remember what it was called back in the day. It was another social media term, but it was like filler face or something like that. But what happens when like the filler goes away? When I was first asked about it, I was like, it's not a big deal. Like, 'cause you have to put a lot of filler in your face to have it actually make your skin get stretched out and deflate. But now that I'm seeing these people, I'm like, oh wait, these are the people that put way too much filler in their face. And when it dissolves or when it goes away, their face is going to be like a weight loss patient's face. It's just going to deflate, and they're going to have extra skin, and then they're really going to need a facelift. So absolutely, you can go and plump your face up as much as you want. Go to it. Find a practitioner that wants to do that for you. If that's the look you want, that's great. But just know that it does come with its own potential side effects as well.
Yeah, I mean, I think that's pretty much it. We're obviously surgical advocates.
Right, because that's what we do. So, yeah, you ask,
We see the results with surgery. We like the results. That's where once again, go to the before and afters on the Instagram and the websites and, see if you like those. And if you don't like them, then you're not talking to the right doctor. You got to, if you want to get that look, like you're not going to find that look on my stuff. If you're looking for that mantis lift or whatever, you got to go somewhere else. I just don't do that. I make people look good, in my opinion.
Yeah, in your opinion.
In my opinion.
Yeah. And the other thing, too, that I understand that, when you're on TV and when you're making public appearances, you do have to wear a certain amount of makeup. That's fine. But, I would just rather have beautiful glowing skin that's beautiful glowing skin and not filled with a bunch of pancake makeup. So if you're doing the lasers for the spots and the hyperpigmentation, you're doing microneedling for overall glowing and youthfulness, and you're using all the products to make sure that you have that smooth skin, a little bit of Botox here and there to help smooth some of the fine lines. I would way rather have that as the skin canvas than an inch of pancake makeup. So those are just my personal thoughts, but obviously you do you, and whatever floats your boat.
We support it, but it's just for a little bit of awareness. This is a good little discussion.
Yeah, so that's the MAGA Makeover. If you really want to get the Mar-A-Lago face, we've given you excellent pointers on how to do it. So go forth and prosper.
Yeah, make some comments. We want to hear from you all. What do you think? MAGA Makeover, or is it time for something different?
And yeah, I think that's pretty much it.
Then this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.